Good intentions do not automatically equal good policy. What if a government policy that promises to slash America's drug prices actually ends up cutting off patients from life-saving medicines, not just in the US, but around the world? It could happen. The most favored nation rule, MFN for short, sounds diplomatic, but it's really a backdoor price control. It tells drug companies that whatever the lowest government-mandated price is in another developed country, that we will also pay that price in the United States. Try to picture for a moment a company about to launch a breakthrough therapy. If selling that drug in Germany, France, or even Canada will yank down the US price, why launch there at all? Many firms would simply skip those markets, leaving patients in smaller developing countries waiting years, possibly forever, for the same medicines that Americans already benefit from. Price caps don't stop at borders. They squeeze research budgets everywhere. When revenues fall, companies do actually cancel the riskiest clinical trials and shelve projects aimed at rare illnesses. Fewer experiments mean fewer cures and longer wait times for everyone, everywhere. MFN also scrambles trade diplomacy. Instead of cooperating on access, Washington would just start twisting allies' arms to raise their own prices so US politicians can point the finger elsewhere. In a letter sent last week to the White House by 20 US senators, including Senators Todd Young and Tom Tillis, they say the US should, quote, pursue the removal of policies and practices abroad that have the effect of forcing American patients to pay for a disproportionate amount of global pharmaceutical research and development, including by suppressing the price of pharmaceutical products below fair market value in foreign countries. Now, this is a thing that is actually happening, and the US might be trying to use trade negotiations to remedy distortion of the pharmaceutical market. Overall, we should try to avoid this. It's not partnership, it's closer to coercion. Wrap that coercion in patriotic packaging and the result is the same. Patients, especially those most desperate, lose. And when you're talking about health, that might mean life or death. So why is President Donald Trump championing a most favored nation scheme for Medicare and Medicaid? His allies float a headline number of $800 billion in federal savings over a decade. But that number collapses on contact with the actual balance sheet of the US. First, Medicaid already claws back more than half of what it spent on drugs through mandatory rebates, 52% last year. And second, drugs are a rounding error in the program's budget, less than 4% of total costs, while hospitals soak up almost 10 times as much. You could give away every pill in the pharmacy and still miss that $880 billion target by a mile. The worst factor is that if you squeeze manufacturers too hard, they fight to stay afloat. Eaton Pharmaceuticals recently tripled the price of a rare pharmaceutical up to $14,700 per vial because half of its users are Medicaid patients. Even after the hike, the company says it struggles to actually be profitable. Meanwhile, Chinese labs announce a new CAR-T breakthrough seemingly every week. Do we really want to handcuff American industry that still leads the world in biotechnology? There's a better path here. Speed up FDA approvals so more products reach pharmacy shelves faster. Competition, not rulemaking, is what ultimately drives prices down. Then you go on to reform the pharmacy benefit managers whose rebate tricks inflate consumer prices long before a drug ever hits the counter or reaches a consumer. Nobody wants to live in a world where you can't afford the medicine you need. MFN pricing feels like a quick fix, and that's appealing to some people, but it delays access abroad, threatens American research, and delivers very little relief to people in the healthcare system. Instead of importing foreign price controls, clean up the supply chain and keep the pipeline for new cures wide open for patients everywhere. Do like the video, leave a comment below, and tell us your stories dealing with drug pricing in the United States and around the world. We want to hear them. I'm Stephen Kent, and you've been watching The Consumer Manifesto.